Hey everyone, welcome back to Einstein's Eyes. I'm your host, Carl Rosen, oculoplastics, neuro-ophthalmology in Anchorage, Alaska. And I'm with my delightful, insightful co-host and former co-resident at Einstein, John Ditkoff. John?
Hi, everyone. I'm a general ophthalmologist. I've been in northern New Jersey for about 30 years. I specialize in cornea and external disease. Carl and I trained at Albert Einstein residency, hence Einstein's Eyes. And it's really a pleasure to have a guest today. I'm really excited to hear some information I might not know that much about. So, Carl, you can take it away.
Yeah, so thanks, John. So today we have a special guest, a chiropractor. We've never had a chiropractor on, so we're really interested in hearing about chiropractic care and chiropractic treatments from Dr. Robert Pesale. Rob is in Connecticut and
Stratford, right? Stratford?
Yes, Stratford, Connecticut. Yeah.
Stratford, Connecticut. So we have New Jersey, Stratford, Connecticut, and Anchorage, Alaska. I think we cover the bases pretty well. And today we're going to talk about really a subject that's really fascinating and really not on everyone's radar, the role of chiropractors in medicine and potentially in eye care. But we're going to hear from Dr. Pesale and really take it away.
All right. So nice to meet you guys.
I guess I would start with Rob because I'm really curious. Rob and I have known each other since high school. And Rob, tell us a little bit about your journey, meaning when you went to chiropractic school and how you chose that.
Okay, interesting. So when I was in high school, I played football. And then when I went to get my physical for basketball, the doctor noticed I had high blood pressure. So I went through all these tests. They couldn't figure out why my blood pressure was high, even though I was in good shape. I had a little family history of blood pressure issues. And then I tried a chiropractor, and my blood pressure went down about 20 points after I was treated. At the time, there was no scientific proof of that. But over the years, the University of Chicago Medical School did a study on chiropractic adjustments and blood pressure, and pretty good efficacy of blood pressure reducing when people get chiropractic adjustments. So I kind of stumbled into that, and then that's what I wanted to do. I ended up doing a 3+1 program at New York Chiropractic College to start off with, where you do 4 years of college in 3 years. I think that's something similar to what Dr. Ditkoff did at CCNY, right? So then after 1 year at New York Chiropractic College, though, I was very unhappy with the school at the time. So I transferred to Palmer College of Chiropractic in Davenport, Iowa. That's where chiropractic was originally founded. And I just loved my experience there. And then when I graduated in December of '87, I worked with a couple of doctors in New York City. One had a great effect on my career, Dr. Franklin Gilbert. He was on the Upper West Side. He kind of really taught me like the basics of how to treat patients and how to care for people. It was kind of a fun practice. We saw a lot of celebrities, so it was interesting, a lot of dancers, ballet dancers. And then I moved to Connecticut. I opened my own practice in November of 1990, and I've been here since then. And now I'm proud to say that my son, Drew, is a chiropractor, and he's been in my office for the past 4 years. We have a pretty diversified practice. I sort of specialize in patients who get motor vehicle crashes, people with disc herniations and disc problems and postural problems. Dr. Drew is really good with athletes and sports medicine. So it's a pretty diversified, fun practice to be in. And I love it.
Do you deal directly like with a neurosurgeon, neurology?
That's a great question. Because now they have research that shows when patients who are candidates for surgery, who get fusions, I'll get referrals from the neurosurgeons to treat them for a while to try to restore the curvature, because there's research that restoring the cervical curvature or the lumbar curvature will improve the patient's outcome. It's aligning the sagittal section of the body. So when that's more in balance, because we live in a gravity environment. So if we walked on all fours, these things would be a problem. But the fact that we're upright and we move and we're designed to move, that's a very vital component of the treatment.
Do you, so if you have a patient like that, what I was always curious about is, like, I've had back problems, and I always think of like multifaceted approach. I mean,
right.
One of them could be medication. So like as a chiropractor, you can't prescribe. Is that accurate?
No, we do not prescribe medication, but look,
Right.
with any case in any kind of situation, is diagnosis, prognosis, treatment plan. So
Right.
you have to have high interest and high intent for the patient to see what their problem is. I work very closely with orthopedic surgeons,
Right.
neurosurgeons,
That makes sense.
primary care doctors. We refer patients to pain specialists. So basically, we try to diagnose the patient and do what's best for them. So of course, we want to avoid having a patient take continuing medication their whole life because that's not great for your kidneys, your liver, and your overall health. So if we could avoid that, we try to, but you have to use common sense first, right? So if a patient is suffering and they can't continue, and what we're doing is not helping, we have to refer them to someone who can.
Yeah. So, Rob, let me ask you a question. So, I know chiropractors focus on posture correction and
Yes.
ergonomics, right? So, and that alleviates muscle strain on your neck and shoulders, which, as an ophthalmologist, I no longer do cataract surgery. I don't think, John, you don't do cataract surgery anymore
Stopped.
either, right? I stopped, yeah. But we would get strain looking through the microscope because you're always hunched over.
Right.
And so, I mean, does that sort of speak to what you do? I mean, could you help folks like John and I?
Oh, that's my wheelhouse. So I'm certified in a technique called chiropractic biophysics. It was developed by Dr. Deet Harrison and his father. They have, I can't even count how many research published journals they have to prove how we can correct the spine. So basically, we'll get a patient, let's say, with a 75% loss of their cervical curve. Well, that disrupts their biomechanics. It creates a forward head posture. You get more weight on the lower part of your cervical spine. That's what causes the degenerative changes. So by reverse mirror imaging traction to the cervical spine, provided after we go through all the tests, provided that it's safe to do, we institute various mirror image traction methods to restore the curvature of the spine. And we have predictable, reliable outcomes on how to do that.
Wow, wow, wow.
Yeah.
That's good. Yeah.
I recently had a patient. She wasn't even in any pain. She was getting married, and she did not like the way she looked in her wedding dress because she had a large hunch in her thoracic spine. Well, we X-rayed her. We treated her for about 6 months. We did pretty intense traction on her, and she's pretty much normal now. And she had the best time at her wedding.
Yeah, if my wife watches this video, she's going to want me to do this. She says she makes fun of it.
Well, that's actually, that can be fixed.
Yeah, I mean, I definitely. I think it partly, like Carl said, a lot of it's ergonomic. Like it's our work. I mean, I
Right.
spend the whole day looking in a microscope,
Looking down.
my head down. So it's not
Right.
great. Even though I try to exercise and all those things, it's not the same.
So what you have to do, you have to, mirror image reverse that, and the ligaments hold the spine together. So you have to create ligamentous creep. So that takes about 20 minutes to do, and that makes the ligament change, and the spine will change because the ligaments hold the bones together.
Do you also create like exercises for your patients?
Oh, there's many different exercise programs we give patients based on what their issue is.
Rob,
Dr. Drew really focuses on that part of the practice.
Right.
So are you seeing more chiropractic patients? Are you seeing more issues? Because a lot of people sit a lot,
Oh,
They
yeah.
sit-
Well, especially nowadays with people that, if you go into a restaurant or you're on the train or you're at a movie theater, what do you see? What are people doing?
What's on their phone?
They're on their phone. So what do they do? They're like this all day, right?
Yeah.
So just that in itself. I mean, people do not take care of their posture.
And
Typically.
more people working from home for sure. So
Right.
Yeah.
So they're on their computer, their station's probably not set up properly.
Walk me through the process, the workflow. Somebody walks in,
Oh,
they got a
sure.
problem. Yeah, go ahead.
My staff better enthusiastically greet the patient. So the patient's going to fill out a lot of paperwork. We go through a very thorough history. I really like to sit down with the patient and take time with them. My wife says every time she goes to a doctor, she feels like she's rushed out. And now that we have, more than one doctor in my practice and we have a lot of staff, we're able to sit with the patient. And I like to say, okay, just start from the beginning. And they're like, well, I don't want to take you through the whole thing, but I'm like, I insist. So we just go through every single part of their health. We go through their review of systems. We go through their chief complaint. We find out what makes it better or worse, all the standard things. We get a medication list. And then we typically will take x-rays of the patient. And depending on the findings, we love to do magnetic resonance imaging studies. And we actually read our own studies. Dr. Drew and I both taking a fellowship with the University of Buffalo Medical School, which trains us pretty intensely on how to read magnetic resonance imaging studies. So we combine that with the history and the patient's past treatment to develop a treatment plan depending on what they have. So we tailor the program to include whether it's traction, spinal decompression. We have various forms of pain-killing modalities. We do exercise. So it just depends on what the patient needs. And then there's an endpoint. So, you want to make sure that the patient's functional activities of daily living is improving. So that's really the main goal, right? You want to have the patient do what they want to do. Like, Dr. Ditkoff and I like to play tennis. I'm like, I don't know what I would do if I couldn't play tennis. So you want to find that hot button on the patient of like what they love. And that's how you make them happy. They get rid of their pain, they can do their activities, and that's the outcome. And if we don't get that outcome, we try whatever we can to refer the patient to someone who might be able to help them concurrently to what we're doing. So it's a pretty non-invasive, safe form of healthcare.
Right. So, Rob, with any medical treatment, there are risks. Can you
Yes.
tell our audience, you guys do neck manipulations, you do various traction relief, etc. What manipulations or what things are red flags to you and what carries risk? I know that the risks are small, but what are they for folks?
Yeah, there are risks like in any profession. The good thing about what we do, it's relatively safe. I mean, my malpractice insurance is $2,300 a year. So if there was rampant issues, it wouldn't be that cheap. It's pretty easy to spot someone who you shouldn't treat. So, for example, if you have a patient who is really overweight, is a smoker, deconditioned, doesn't take care of themselves, and then you take their blood pressure and it's 200 over 175, right? And then we do certain tests to see if there's vertebral insufficiency in blood flow. And then you look at their history. You're probably not going to manipulate that patient, right? You're going to probably refer them out to someone who is going to get them a little more stabilized. On the other hand, you have patients, and that's like visceral problems. And then I'll have a patient, let's say they have, some people have what's called the myelopathy. So a myelopathy is when someone gets a disc herniation in their neck, for example, and it puts pressure on the spinal cord. So during my exam, if I'm doing reflexes on the patient and their lower extremity reflexes are hyperactive, alarm bells go off. So you're not going to manipulate that patient. You're going to refer them immediately for an MRI and right to the neurosurgeon. So there are, just from basic anatomy and basic history, you get most of it from the health history, and then you do your exam, and then you apply what's the safest method.
As you're speaking, do you think there's a role like in human resources? Like, how these huge companies now that have half their workforce working from home, where they would have someone like you come in and like talk to the employees about setting up their workstation and what they can do to decrease the risk of injury. And
yeah, I think that's been going on for a while though. I mean, I know a lot of people who actually do that. I've done that in the past. So I think that's a pretty common practice nowadays and has been for a while, I think. Whether the patients actually do it is another thing.
I know where my office is located, there's some chiropractors. I've had patients tell me that they help them with migraines, or they help them with some of these kind of more out there things that obviously you're not doing that. But what do you think of it?
Well, I mean, so chiropractors do not treat those conditions, but they are side effects to the treatment sometimes. Like people who have blood pressure issues, or people who have digestive problems, or people who have allergies or asthma.
Right.
You cannot tell a patient that that's what you're treating, because you're not. That's medical practice, right? So for chiropractors to advertise that is false, right? But we could talk for hours on the nervous system and how the spine controls the function of it, and how pressure on it or dysfunction over time, causes problem with the spinal cord and its transmission. So that can affect your health in many ways. So to say that they're treating those conditions are false. I've had countless, patients over the years who've suffered from migraine headaches and all types of headaches that have improved. Why is that? Well, a migraine is more of a vascular headache, right? I don't even think anyone knows even why people get migraine headaches.
Yeah.
But people who get cervicogenic headaches, easy fix because usually it's muscular in nature. And by improving the biomechanics and the range of motion and the posture, you're decreasing the force on the cervical thoracic spine. So you're taking the pressure off, you decrease spasm, increase motion, and their headaches go away. Did I answer that?
Yeah, no, that was really good. Very, very informative.
It sort of highlights the importance of chiropractic care as part of overall health. And I think that the more we understand about the connections with our bodies, the nervous system, the spinal column, the skeleton in general, the better we can take care of ourselves.
Yeah.
So, thanks, Rob. Thanks for highlighting some of those things.
I have
And-
one more story, Carl.
Go ahead.
Just recently, it's just really interesting to me. So I have a close friend who was telling me about his big toe that was inflamed. And of course, his doctor thought he might have gout. He thought he might have gout. I thought he might have gout. He eats a lot of protein. His uric acid levels were normal. Everything was fine. And then he thought maybe he just injured it walking. But at the end of the day, actually, it ended up being related to his spine. I never would have thought of it. But he had some, I don't even know if he went to a chiropractor. I just know that his spine was the cause because ultimately, when he was treated for his spine, it completely went away.
Yeah, a lot of times patients' symptoms, if they have a spinal like disc herniation or problem like that, they'll get extremity symptoms before they get a back problem.
Yeah, it's very interesting.
Very common. Yeah.
I didn't think of that. Carl, have you seen that with your friends or yourself or anyone you know?
I got to be honest. I'd be making stuff up.
Yeah, no, I'm just curious. It's not for me. But he's a very close friend of mine. Just literally like a week ago, told me this whole story.
Yeah. No, I'm curious, and but I have yet to explore that. But Rob's helped me, and maybe I will dive into it sooner than later. But yeah. But listen, thanks for being here, John. Thank you as always, and to our viewers, we'd love to hear your thoughts. And please like and subscribe, share the video, and we'll see you guys on the next one. Thanks a million.
Thanks, everyone.
Thank you.